That's such a tough question to answer, I think. So first, I'm not a surgeon, right? So if you asked a surgeon that question, they may give you a totally different answer. So I'm not talking about it from a practical experience since I don't do surgery. But I could tell you that my overall impression is that a lot of times I see a lot of surgeries that are done that are unnecessary. And so I'm not saying a cystectomy is not unnecessary, but I would say it's definitely one of those things where you want to get different doctors from different institutions to weigh in on it and give their impression. Then let's assume it is necessary. For the example here, there's a lot of issues that develop afterwards. When you remove the bladder, there's a lot of rehab and therapy and other things that have to be done to help someone to urinate, close to normal again. And many times there's sexual dysfunction issues that happen afterwards, or there's other secondary problems that develop after those surgeries. And that could totally change. If you're let's say a younger person and this happens, that's the rest of your life that it could have a significant impact on. So the idea is that on the one hand, you don't want to wait too long to make a decision and increase the risk of you dying from the cancer. But on the other hand, you don't want to run right in to get a surgery because the consequences could be life-changing.
What are some of the side effects if somebody, should consider if a doctor or a surgeon is recommending that part of their bladder be taken out because of bladder cancer? I mean, what are some of the things that could go wrong?
Yeah, so some of the side effects that are associated with that, well, there's general side effects that you would say are possible with any surgical procedure. So, you're gonna have anesthesia, so you may have a reaction to anesthesia. Since you are having a surgery, there's always a low risk for an infection. Anytime you breach the skin barrier, there's a possibility of an infection. After surgery, there's a possibility of bleeding from the surgery. There's a possibility of developing blood clots throughout the body. There's a possibility of damage to nearby organs. You have the possibility of either an infection at the organ site or an infection throughout the body. Sometimes it just gets in the blood and travels. You have, and then I guess maybe a simple one that I should have probably led off with is pain after the surgery. Now, one of the things I didn't touch upon, though, is that there are a lot of newer robotic surgical methods. There are certain, I was reading at some data from a medical center in Japan that is doing the vast majority of their surgeries using robots. And people might say, man, I don't want a robot touching me, because we're used to human beings, right? We're not used to robots. But the outcomes are extremely impressive, and it's hard to ignore. A robot doesn't get tired. They don't need to take a break. They don't get fatigue, like, oh, I did 10 surgeries, I'm getting tired. And, their accuracy is far more accurate than a human being, and for some of these surgical procedures. So I would imagine in the future, more and more people are going to be requesting that as opposed to being afraid of that. So it's something to consider. It might not be something everyone jumps right into, but it's something to consider. The significance of that, by the way, is that the robot will most likely not damage as much healthy tissue during the process, the surgical process, where a very skilled surgeon may have to, go around. Surgeons are trained never cut through cancer, but go around it. And the idea behind that is you minimize the likelihood of you spreading the cancer after surgery. So that means they're going to cut into healthy tissue, and so if you have a robot that can cut closer to the cancer line or cancer margin line, then there's less damage to the healthy tissue after the procedure. So I'm asked all the time by patients, what's the difference between personalized medicine and traditional medicine? And in traditional medicine, there's a singular approach. So you have cancer A, and for cancer A, here is the standard of care treatment. And after you go through the standard of care treatment and it doesn't work, typically there's not a plan B. There's not another option. So then patients are told, hey, there's nothing else that can be done. And so then they're convinced that, hey, there's no hope and we can't do anything else. Now, I want to contrast that in a personalized approach that we have at Causenta. We're going to measure all kinds of details within your body. And we're going to find lots of areas that we can actually improve your health. And then indirectly, by improving those areas, we're going to help you do a better job at fighting cancer. So where someone else would say, hey, there's nothing that could be done, we're going to say, hey, there's lots of opportunity here to improve your health and make sure that you have a better quality of life so that you're able to function and live life under your own terms and not just waste away in a bed in hospice somewhere and watch everything go by you as time passes on. So if you or a loved one has been diagnosed with cancer and you're looking to get help, I strongly encourage you to go to causenta.com and fill out the form at the bottom of the page and find out for yourself how we can help you.